Good morning, everybody. Welcome to SCAG's Toolbox Tuesday. My name is Julia Lippy-Klein. I'm a program manager at SCAG. And I want to welcome you to our session today on SCAG's Disadvantaged Communities Active Transportation Planning Initiative. I think folks are going to continue to join as we chat, but wanted to get things going. Start off with a few logistics. Lyle, if you want to go to the next slide, thanks. Just so you know, this meeting will be 1 hour. It might appear as 2 on some calendar invites, but we'll go for about an hour. The meeting is being recorded. All participant lines will be muted. At the end, we'll have a Q&A. So feel free to ask any questions. If you do have a question during the presentation, please type it into the chat box, or you can press the raise hand function, which is at the bottom of your screen at the bottom bar. We'll log all the questions and then voice a selection at the end of the presentation. A recording of the webinar and the PowerPoint slides will be available to everyone on the SCAG website shortly afterwards. And we'll send a link so everyone who has registered can view that. So just a little bit of background. We know that a significant challenge to the development and implementation of the RTP SCS is the lack of comprehensive countywide and local active transportation plans, which serve as the basis for regional active transportation planning. SCAG aims for all local jurisdictions to have high quality local active transportation plans as inputs to the regional planning process. So this project, the Disadvantaged Communities Active Transportation Planning Initiative, plays a really critical role in achieving this goal with the development of a low-cost, high-impact model to develop active transportation plans. So this initiative leveraged SCAG staff, data, and outreach resources to develop context-sensitive plans in high-need, historically disinvested cities and unincorporated areas. Through this model, plans can be integrated into existing and emerging regional active transportation infrastructure and frameworks. So with that, I'd love to pass it over to Sam Corbett, principal with Alta Planning and the lead consultant for this project. He'll introduce the panel that's speaking today and kick things off.
Great, thanks, Julia. Can everyone see my screen? Is it showing up with the new presentation? All good, okay. As Julia mentioned, my name is Sam Corbett. I'm a principal with Alta Planning and Design, and I've been serving as the project manager for the Disadvantaged Communities Active Transportation Planning Initiative. And I am honored to have an all-star panel with me this morning. I'll just briefly introduce my fellow panelists, and then we'll get into the presentation. Courtney Banker is a planner with Alta, and she was the lead planner on 2 of the active transportation plans that we developed, specifically cities of Paris and Calipatria. Wendy Romero is the founder and CEO of Love for Life, a community-based organization in Paris. Jennifer Lilly is the Community and Economic Development Director for the city of Stanton. So there were numerous reasons for developing the active transportation planning initiative, several of which Julia already mentioned. So I'll go over this fairly quickly. But certainly pedestrians and cyclists are disproportionately impacted by fatalities and serious injuries. We also know that about 2/3 of SCAG's high injury network are located in disadvantaged communities. And unfortunately, only about a quarter of these communities currently have active transportation plans in place. And that's often due to lack of resources or other competing priorities. So just a little bit of background on this project. We've been working on this for roughly 2 years, starting in 2019, and we're about to launch the toolkit this summer. The overall intent is to make this more accessible to communities so they can develop their own active transportation plans at relatively low cost. We did pilot this in 7 different communities, sort of ranging from more urban to suburban to some rural communities. And I should mention that the team supporting SCAG in this initiative was Alta and our partners Studio 111 and Urban Design for Health. So just a few goals, several of which we've touched upon. We're really striving to deliver a low-cost model for developing active transportation plans, making sure that it's accessible, easy to use. We're also looking to expand the value of SCAG's already existing active transportation resources, including their active transportation database. Certainly, a key focus of these plans are aligning them with the statewide program, the active transportation program, so that we're setting these communities up for funding opportunities. And also just a little more background on the development of the plans themselves. We did a considerable amount of research on best practices. We convened focus groups. We looked at other plans to really sort of pull the best material into the overall toolkit that we developed. There was also a very strong emphasis on community engagement, and particularly engaging communities that have historically not been as engaged and have even been left out of the planning process or adversely impacted by transportation planning work. So we had a whole equity framework that really guided the engagement process that we followed really closely. We also had community advisory committees set up in each of the 7 communities where we piloted the active transportation plan. And these community advisory committees were made up of various constituent organizations, residents, businesses, school groups, et cetera, from throughout the community. And another key focus that you'll hear about more from Wendy was the importance of community-based organizations. And in many instances, the CBOs were social service organizations, which were invaluable partners because they provided us with that opportunity to really connect with harder to reach populations in each of the cities and communities that we worked in. I should also mention this slide shows all the different engagement activities that we conducted as part of this project. All activities were available in Spanish as well to make sure that we were providing opportunities to engage with monolingual Spanish speakers. We had a demonstration component planned as part of these projects, including 2 different training sessions in each of the communities regarding active transportation planning. We were also, about a year ago, we were on the verge of hosting SCAG Go Human demonstration events in each of the 7 communities. Unfortunately, we had to cancel all of those due to the pandemic. So we transitioned from a sort of in-person engagement through the demonstration events to more of a virtual strategy. And we also weren't able to do the counts because that was also happening last spring just as the pandemic was hitting. But we found that we were very quickly able to shift to virtual engagement and online engagement. And I think it was largely credit to our partnership with CBOs that they really sort of kept us connected and speaking with the communities and through a combination of virtual as well as some in-person activities. You can see here there was a photo from Calipatria at one of the food, clothing, and diaper giveaways, where we were also getting surveys out to people so that we were continuing to get feedback and really vital input, which was critical to shape the development of recommendations in each community. And then at the culmination of the project, we now have 7 completed active transportation plans in these 7 cities, or actually 6 cities, and 1 unincorporated community of Saticoy. They've all been adopted except for the Saticoy active transportation plan, which is in the process of being adopted. And these are now sort of moving forward into pursuing grant opportunities and implementation. So it's really exciting that these communities have leveraged this planning effort and are moving towards creating better connected, safer, more comfortable active transportation facilities. And just a few key lessons learned before we go into a little more detail on the toolkit itself. There is certainly significant appetite for active transportation improvements. We saw this throughout all 7 communities that we worked in. A theme we saw time and time again is that city staff are resource constrained. And even with the toolkit in place, we're anticipating that some cities may still struggle to have the resources to develop their own active transportation plans without further support. The community engagement approach was critical to have these partnerships with the local CBOs, still trying to get out into the community as we could, following appropriate county public health guidance, and taking really a variety, multi-pronged effort to our outreach to make sure we are reaching as many people as possible. And lastly, planning efforts can and really must adjust to the pandemic. And we found that we still, despite the pandemic and restrictions in terms of in-person engagement, we were still able to really effectively engage and stay connected with the community and get feedback on the plans and draft recommendations. So with that, I am going to turn it over to Courtney Banker, who will do more of a deep dive into the toolkit itself.
Thank you, Sam, and good morning, everyone. You can go ahead to the next slide. So the toolkit really consists of 3 components. First, we have a manual, which helps orient folks to the overall toolkit in the planning process. Then we also have a template, which is the actual customizable planning document that communities will use to create their own active transportation plans. And finally, we have a suite of resources available to support communities in this overall planning process. The next slide. When folks first enter the toolkit, they'll also see a toolkit introduction video, which provides an even deeper orientation to the each component of the toolkit, and goes over recommendations for how to approach first-time users of understanding how to move through the toolkit pieces themselves. Next slide. The manual, as I mentioned, really serves as a how-to guide. It paints a picture for understanding the importance of active transportation and the role that active transportation plans play in communities. It also provides more information about the template and specific functionalities of the template that users should be aware of. And it details the various topics covered within the resources. Finally, the how-to guide really sets communities up to understand how to approach an active transportation planning process. And that includes tips for forming a community advisory committee, developing a schedule and a budget, adopting and implementing a plan, and also documenting lessons learned at the end of a planning process. Next slide. Moving from the manual to the template consists of a planning document and then also a really robust tutorial video to help people understand the various functionalities of the template document, which was built in Microsoft Word. So this template tutorial covers everything anyone will need to know when using that document to help customize the colors, utilize header and character styles, navigate the document with the navigation pane, update placeholder graphics while maintaining figure captions and cross-references, etc. Next slide. What's really exciting and the bulk of this toolkit really is the full-length customizable active transportation planning document itself. So this planning document includes, covers every chapter that you would imagine in a plan, including appendices. It features placeholder text and prompts to guide communities in completing and customizing the template itself. And throughout the document, you'll find instructions as sidebar comments from the template user guide that help folks know where to get certain data and kind of how to think about responding and updating parts of the template. The template also includes a Spanish version of the executive summary document, as multiple resources and components of the toolkit are bilingual. Next slide. Moving on to the resources, we have topics, about 12 topics covered in the resources folder. One of the biggest topics that we know is a great barrier for communities is the process of analyzing data. To support that effort, we created an automated data tool that allows communities with a few clicks of a button to get data on collisions, demographics, and connectivity within their community. Next slide. We then created about 30 template map documents that allow folks to utilize that data from the automated tool and also pre-programmed data to create every map that they'll need for their planning document, including existing conditions maps and maps for recommendations and prioritization. Next slide. Complementary to the data analysis process is also conducting a needs assessment. So for the needs assessment folder, we have a user guide on how to conduct an actual needs assessment and a corresponding data workbook, which is built in Excel. And this data workbook features a lot of the normal pre-formatted charts on demographics, but we're really excited too about this component that includes a robust health assessment, utilizing mainly the California Healthy Places Index. So this health assessment allows communities to consider transportation-related health outcomes in their community and how their active transportation plan can help improve those health indicators. Next slide. And those two features, the data analysis and the needs assessment, really work together in the sense that some of those template map documents allow folks to spatially visualize the relationship between health and active transportation. For example, on this screenshot, we see a map that is showing asthma and air pollution. Next slide. As Sam mentioned, this planning process in the toolkit was really envisioned to be very community driven, and the outreach component of the resources helps communities strategize and understand how to approach community engagement using an outreach and equity framework. And then once they've established those strategies, it provides a host of sample materials to help communities in actually conducting that engagement. So those sample materials cover hosting community advisory committee meetings, conducting walk audits with bilingual walk audit forms, community surveys, and also includes an engagement tracker so that communities can easily keep track of the events that they host and the kind of participation that they get in other lessons learned. Next slide. And finally, as Sam was mentioned, this toolkit is really designed for adoption and implementation. In terms of supporting adoption, the resources include sample materials for taking a plan to Planning Commission and City Council for adoption, including sample agenda submittals, staff reports, presentations, and resolutions. And on the implementation side, the template document itself covers a robust section on funding sources And then within the resources, we've included tips from an experienced active transportation program grant reviewer on creating a competitive ATP application. Next slide. So the toolkit will be available to communities starting this summer. We are thrilled to see it in action in the SCAG region and to see the visions come to life as a result of this toolkit. I'm honored now to hand it over to Wendy Romero to talk about her experience working with the City of Paris and our team in bringing the City of Paris's active transportation program to life.
Hey, thank you so much, Courtney. I am very happy to be here and share my experience with everyone. Once again, my name is Wendy Romero. I am the founder and CEO of Love for Life Association. We are a nonprofit for bullying and suicide prevention, mental health, and leadership building. Next slide, please. So something that working with the active transportation plan that we thought it was very important is having a positive and active communication, specifically with the project team. As a CVO, we understand what the community wants. So we always wanted to make ourselves available to help with the project as much as possible. And specifically also understanding the marketing outlets, what is the best way to reach the community? And of course, maintaining an active communication with the community was also very important for us. Next slide, please. As the local CVO, we have the local knowledge and we have the advantage that we know the community. So it was so important for us to understand the demographics, specifically like here in the city of Paris, we know that most of the residents prefer Spanish speaking language. So when as a team, we were all able to identify that. We help with the interpretation and translation of all the flyers, surveys, and workshops. And that was so important and significant because we wanted all the community to be able to get all the information from the project, as well as being able to identify the communication preferences, but what is the best way that the community likes to be reached, whether it's through social media or mail, or they like more phone calls. So it's just so important as a CVO to be able to understand what the community prefers and understand the demographics. Next slide, please. Something that was very important as a CVO is that we have also the advantage that we got the networks and opportunities to connect with other people. So something that was very, very important when we were working with the active transportation plan was our local partnerships. Working with the city was very, very important in order to reach the whole community, but also working with the local businesses took an important role with the project. Due to the pandemic, most of the activities were turned to online. However, we also wanted to reach out to those who prefer to have like in-paper surveys. So we partner up and we identify local businesses that the community likes to attend, and we partner up with them to leave paper surveys. And now the community knew that they could go there if they preferred to do a paper survey. The businesses collected them, and then we just gather all of the surveys, and that was also available for the community. Something else was the educational system. We were able to partner up with the schools and the school districts. They have direct access to the families, and that was an important source for us to take that information to the community. And additionally, local organizations, having the partnership with the local organizations was also very important for us. When we share the information with them, they are able to share this information with their participants, and now we're reaching a wider number of residents. So partnerships was definitely very important as a CVO. Next slide, please. Some of the outreach we did, well, most of the outreach we did was through social media, specifically Facebook, Instagram, and Twitter. We definitely try to keep the community very, very engaged in this project through posts, and stories, also sharing like random facts and just asking them for their feedback. Something else that we also noticed was very important is to identify the local groups. For example, here in Paris, we have on Facebook groups with over 45,000 residents, like what's going on in Paris. So they share news with Paris. So we were able to share this information with that many amount of residents. And that was also very effective. Of course, also when necessary, we share the information through email and phone conversations. So most of our outreach was done through social media. Community engagement was a big part. We really try to involve the families in the active transportation plan. Specifically, we use our Love for Life chapters, our local Love for Life chapters at the various schools in the area, school districts, and the city. We use our youth leadership to send this information. So as you can see in the left picture, that is just one school of Love for Life members, Love for Life youth leaders. They all receive the information, and they also help us by sharing the information with their school and their peers. So it was very special for us to be able to involve the youth in this amazing project. Not only that, but as Love for Life, we also have a Love for Life parent committee with 20 identified parent leaders in the community, and they also help us spread the word about the active transportation plan and be able to get the feedback from the community. And also, when possible, we try to attend local events and share the information with the participants that were there. So community engagement was so important. Next slide, please. I believe that the most significant part of the CVO in this kind of project is that we are able to give the community a voice. We're able to share the information with the community and also get the community feedback. Not only that, but that also allows the residents to be a part of the process. We had many residents that were so excited to share their ideas, their opinions, and like I said, not only does that let them be part of the process, but that also builds a sense of community. So as a CVO, that was truly important that we were able to give the community a voice. And what I would say is the biggest lesson learned as a CVO is, if I can give an advice to a CVO, is to know your community and know the best way to reach them. You probably already have built that trust and relationship with the residents. So you are a very important part of building community projects like the active transportation plan. So we truly appreciate the importance that the project team took on engaging the community. So with that being said, I will pass it on to Jennifer, who will be presenting the last section of the provided city perspective.
Thank you so much. This has been great to watch how other communities have been impacted through this toolkit process. So as you remember from the beginning, I am the Community and Economic Development Director here in the city of Stanton. However, I came into the ATP process about midway. As Sam mentioned, it was a 2-year process, and I arrived in Stanton last summer. So I have this unique perspective. I came from the city of Brea. We actually had just completed our ATP process. And so walking into Stanton towards the tail end gave me this great new lens to look at the toolkit from. With that, we can change the slide. Thanks. So we're going to dig into a little bit of the specifics of how this plan was tailored to the city of Stanton. So the most important thing that I think you've heard through all the presentations so far is that the plan really needs to focus on your community. And in presenting this to our decision makers for adoption, what they could hear in the text of the plan and in how the plan was laid out was the community's voice. They heard common echoes of problems that have been identified, and they were excited to see that there were actually options for solutions to those problems over time. So being able to have something that's tailored to our community, uniquely fits the goals and vision of our community's voice, was very important and was delivered as part of the toolkit. Next slide. Our staff and our decision makers, again, as Sam said earlier, we have a very small team here. We are overtaxed with the demands of the day, as I'm sure all of you are as well. And so the great thing about the toolkit for the staff is that it's easy to use. It's very graphic friendly, and it also translates well to the non-technical professional. So we can sit with our counterparts at school districts, in community-based organizations, with our decision makers, and explain how we got to the recommendations that are in the plan very simply and quickly, and then also what the toolkit encompasses. And the straightforwardness of the document really is helpful as you're going through that implementation phase. How we've couched this to our community and to our decision makers is it is a toolkit, but think of it also as a toolbox. So it's really meant to be able to pick up the different pieces and apply them where appropriate. And it's also not meant to be a linear plan. So as initial needs come up, you can go into the toolkit, see where those needs were identified, and implement there rather than having to go from step A through Z in a more linear order. Next slide. So you saw this earlier in Sam's presentation. So this gives you a sample of the city of Stanton. So we're able to take our community specifically. We have Beach Boulevard that kind of bifurcates the city right down the middle and creates some really significant challenges for mobility. There's the heavy traffic, it's the highway, right? And so biking on Beach Boulevard just isn't an option. And yet we also have great relationships with our adjacent communities in Buena Park, in the city of Garden Grove and Anaheim. And so we're looking for those connections as we went into the ATP process. And so these show some of the bike recommendations, again, looking for forward vision. So we just submitted a grant, for instance, on a Rails to Trails project that's identified as kind of that diagonal spot that will go along the railroad right away and connect to the city of Anaheim as well as the city of Garden Grove. And so we're able to use the ATP to leverage and explain how we want to create those connections and better mobility throughout our city. And then next slide. And then the plan really digs into specifics in real life, what these different bike recommendations would offer and how they can kind of be mixed and matched as appropriate. One of the things that we heard throughout from our technical experts is we are a car-centric community here in Orange County. And so, you know, we have cars parked on the street. How could you give up traffic lanes? What could you do? And so having biking and walking recommendations that also show how you can grow the ATP from starting with something that maybe is less invasive and then moving to a more integrated mobility plan really gave our decision makers food for thought of taking steps to implementation. Next slide. And then again, showing the pedestrian recommendations, we have a really serious issue with car and pedestrian conflict points in our city. So it was great to have our ATP come in, identify those areas, look at traffic calming measures as well as protections, and also how to get our folks through the neighborhoods to the schools, to jobs, and connecting to adjacent services without having to be on that major highway of Beach Boulevard. Next slide. And then again, giving that vision of how these treatments can be put in place and starting again incrementally or wanting to make a big impact. And we'll go to the next slide. So at the very same meeting that we were adopting our ATP plan, we had an incident that had just come up. This is in a residential neighborhood that kind of goes into an adjacent city. The street dead ends, you see the block wall, and if you can see into the picture, a vehicle decided they wanted to cut through to the next community rather than go around. I'm joking, of course, that was an accident. But it's about the 10th time that something like this has occurred. And it was a great awareness for us at this meeting because as our council brought it up, our traffic engineers recommended this solution that you see on the screen that was ultimately implemented within short order of putting up the barriers and the flashing signs. Meanwhile, we were explaining this specific area that is included in the ATP for traffic calming measures actually lighting, and so creating a traffic calming solution, but also connecting the neighborhood. So I wanted to show this as a challenge, as a reminder of having to not just use the ATP in a vacuum where it's a great exercise and then the plan sits and everybody kind of goes back to business as usual. What this illustrated for us is we have to bring our technical team back into the fold on a regular basis and remind them of the tool and how easy it was to use. And so that very evening, we were able to also offer the council the recommendation that we should go forward with implementing the more highly improved ATP plan. And so they have decided to go forward with that as well. So from challenges, next slide, to opportunities. We're also coordinating with our private sector development. We have a lot of development coming into the city, and you can see on the map, it's kind of illustrating that it's all over, which was great news for us with an ATP plan in place that covers the entire city. Next slide. So we're working with our commercial and our residential developers, either through conditions of approval, through development agreements, or just goodwill and good input for their projects to incorporate some of the strategies, both for biking and for pedestrians, into these projects so that we can have better connection. We can implement the plan, which is ultimately the city's goal, but they can also allow for their either residents or their shoppers to have safer and easier ways to get through their projects. Next slide. And then this is another great reminder, at least for us. We have an older mobility plan that was adopted in 2013, and we're currently working on the town center specific plan that will be adopted hopefully next year. And of course, these very same issues of traffic calming, mobility, moving people through our city come up. And what we were reminded is now we have this great toolkit, rather than keeping all of these documents independent. This is really our opportunity to build the connection into them, capitalize on all of the technical expertise that's been included, and incorporate those pieces of the toolkit into this new specific plan and measure the old mobility plan with these new tools. The last piece on our next steps is, because community engagement has been so important and so embraced in our community, we've launched a page called Let's Talk Stanton. And it's just barely in its infancy, but it will kind of pick up where our ATP work has left off and allow people to take photos of, hopefully not that crash site that you saw in the earlier picture, but things that are concerning to them in their neighborhood, and even share with us solutions that they have. We'll be able to share the toolkit options for them to consider and kind of vote on. Do you like this? Would you like to see more? And share that with our decision makers as we move forward to implement the ATP. Next slide. And I think I will turn it back over to Sam to close us out.
Great. Thanks, Jennifer. Well, that leaves us with about 18 minutes for any Q&A. So happy to open it up. Maybe I'll stop sharing my screen. And we can see, it looks like there have been a few questions in the chat. I think basically you can chat questions, or if you want to raise your hand and unmute yourself, you can also just ask a question to the group. Maybe I'll start off. So CBO, so yeah, that's what was already answered, community-based organization. I'm not sure if this was covered, but is the toolkit available for public use? So yes, it will be. But not quite yet. We're still, the early summer is the anticipated launch date for the toolkit. So probably somewhere around July or June, July timeframe, we're expecting to have it. And the idea is that it'll get posted on SCAG's website for download, likely as a zip file. It's a fairly large, all of the files combined are quite large, but it will be publicly available. Any other questions from the audience?
Hi, Sam. This is Lyle. We did have another question come through as a private message. It was for Courtney. And the question is what data sources are used in the automated data tool?
Thanks, Lyle. That's a great question. We have the data sources kind of pulled from a number of things. For the collisions data, we're looking at collision data for the state of California from SWITRs or TIMS. I'll think about those acronyms and tell you them later, but for demographic data, it's using data from the American Community Survey. And then for the connectivity analysis, we're really relying heavily on OpenStreetMaps data, and for that on data on existing points of interest and existing bikeways to understand how folks are able to currently get around the community and what kind of experience they might have in terms of level of traffic stress or bicycle comfort.
Hi,
and I think you had mentioned too, Courtney, that the California Healthy Places Index too was a key data source, especially for some of the health related data sets like pollution, tree canopy cover, things of that nature.
Yes, thank you, Sam. The tool itself uses only those few data sources that I was talking about, and then the map templates cover a ton of data sources. So for that, we've got existing land use. We have maps on a variety of health indicators that aren't typically included in most active transportation plans, but are really important to think about. So that pulls from the National Index for Walkability. We've got maps for that. We have maps on asthma, air pollution, incidence of obesity, a number of other data topics as well. Thank you for bringing that to the attention, Sam.
Hi, this is Jane Rands. I'm a community member in the Active Transportation Committee in the city of Fullerton. Just wanted to give a shout out to Jennifer Lilly. She's one of the residents here in Fullerton. And I had a question, and it actually came out of when Jennifer was talking about the issue they have with having to work around Highway 39. We have some of those issues here. I know specifically like the 57 freeway creates a huge impact for pedestrians and bicyclists trying to get safely to Cal State Fullerton, just as an example. But some of those, how do we coordinate our plans with county priorities, such as Highway 39, and with state priorities, such as Caltrans? Is there some idea of how we can work best to implement our plans and coordinate with those larger entities?
I can take a first shot at answering your question, Jane, and then maybe Jennifer, I'm sure you have a lot of experience with this too, if you want to add on. I would say in the first instance, it's really important that we invite all of those different jurisdictions and entities to the table early on in the planning process. For example, in the city of Stanton, there was a concurrent planning effort along Beach Boulevard. It was actually a multi-jurisdiction planning effort led by Caltrans and OCTA at the time. So I think it was really important that we understand what their goals were, what their process was, where they were in the plan development for Beach Boulevard, and that we just coordinate on efforts. And we talk about, sort of areas of overlap and where we can work together to make those improvements happening. We also had a lot of coordination with Caltrans on one of the plans that Courtney was involved in Calipatria. because they're two state highways really that intersect Calipatria in Imperial County. So working with them and understanding what their capital improvement program is and what their priorities were, so that anything that we were recommending was in fact feasible and was something that would have the support of Caltrans, because we obviously didn't want to make sure that we were in step and that anything that was being recommended was in fact feasible and implementable. So maybe I'll open it up to Jennifer or anyone else who wants to comment on this one.
I'd love to. Hi, Jane. Good to hear you. So the other thing that I would recommend, we did this work pretty effectively in Brea, and we're working very hard to bring it to Stanton, is also to get to know the local committees and commission members that are at that county level, and also make really strong partnerships with our adjacent communities, strengthen numbers. So when we walk into a county board of supervisor meeting and come in with our counterparts in Garden Grove and Anaheim and sharing how we're trying to make this more effective transportation loop, it carries a little more weight than if it were just Stanton who wanted an independent project with no connectivity. So we've had really good success through OCTA, through Caltrans, Imperial Highway and Brea, and now Beach Boulevard, trying to explain our vision, as Sam said, understand what their constraints are and limitations, and then how we can work together to implement or adjust so that we're not kind of continuing to battle something that may take 30 years when we can make an adjustment that we can implement more immediately. I don't know if that's helpful, but that's been our approach.
Thank you.
I see there was a question from Paul Zykovsky. Will the toolkit be usable for other parts of California outside of the SCAG region? And yes, absolutely. I would say the only, Courtney, correct me if I'm mistaken on this, but I think the only thing that's really specific to the SCAG region is the data analysis tool, which has been set up for all of SCAG's jurisdictions and communities. So that, I believe, is tailored to the SCAG region, but I think everything else in the toolkit would be applicable to other communities throughout California.
Yeah, thanks, Sam. And to add to that, I wanted to clarify that the data tool, the map templates, for example, are set up with, in some instances, SCAG specific data, but we included instructions for communities who need to pull in different data to easily be able to do so. So it should be a pretty seamless transition for folks in the SCAG region and outside of the SCAG region.
Any other questions from the group?
I'm not seeing anything on my end, Sam.
Okay, maybe I could just ask a question for the group. Do you have any feedback for us? As we mentioned, this toolkit isn't being launched until June, July of this year. So we still do have some time to make modifications, enhancements, improvements to the toolkit. Is there anything that we missed? Is there something that you'd like to see us, modify or add that you think would make it more usable? I mean, that really our goal with this toolkit is we want, as Julia mentioned at the outset, I think our single measure of success for this is to get as many communities in the SCAG region, and I guess throughout California for that matter, and particularly disadvantaged communities, although this wasn't asked, but this toolkit can also be used by all communities, to use it to create their own active transportation plans. And we've developed it to be, as we mentioned, as user-friendly, as accessible, providing as many resources as possible, but perhaps we've still missed some things. So if any of you have any ideas or suggestions of items you'd like to see us add, please let us know. Oh, comment from Paul. Found Word to be a real challenge in dealing with graphics. Did you consider using a different program? If not, are you happy with how Word handled? Yeah, so this was a big issue. we definitely grappled with this exact issue early on in the project, and it was really a balancing act. I think you're completely right, Paul, that Word does not handle graphics as well as other products, but it was that balance between it being really accessible, and I think what we learned was that pretty much everyone has access to Word, and it's a very accessible program that you know, most people, most staff know how to use. So we thought about using a different program, you know, such as like an Adobe Suite program, InDesign, something like that, that obviously has a higher quality graphic capability. But the barrier to entry and the concern about access really sort of drove us towards Word. And I would say, Courtney, you may have some things to add. We tried to do as much as we could within Word to make it as graphically compelling, and we really tried to max out Word's capabilities from a graphics perspective.
Great, understood. Thank you.
Oh, and one more thing that I wanted to contribute to that is understanding the challenges of Word and kind of using some higher level functionalities of Word to really emphasize graphic presentation. To help communities understand how to use those tools, we developed both that template tutorial, which is a 15-minute in-depth video covering and building a lot of skills for long-term use outside of just the active transportation plan. And then there's also a supporting PDF to help guide folks through using some of the functionality of Word.
And we had another question. How does the toolkit aid local governments to collaborate with programs that already address disadvantaged communities such as HUD and federal funding? In other words, is it user-friendly for the layperson to navigate? And are there lots of global visual symbols to aid language barrier communities like the deaf populations? Yeah, good question. I think we tried to address some of those issues. I should note that the toolkit itself, while some of the materials are certainly, they will all be publicly available. And I think in promoting it, we're planning to really go far and wide and promote it to as many communities and to a really wide audience. However, it is intended to mostly be used by city staff or county staff, or staff that would be developing the active transportation plan for that local jurisdiction. And any other sort of comments on that one from the panel in terms of the sort of symbology and other language barrier issues?
Sam, I might just say, again, having the benefit of a comparison of this toolkit method and creating in Brea our own ATP that was unique from start to finish. And I would say this is very easy to maneuver. It's very user friendly. And we have already, in Stanton, we've already been able to use the graphics and the information that's showing examples to illustrate how the tools can be implemented. So in terms of the technical document, it's sound, it's ready to go, and it's easy to explain across engineers, planners, and decision makers. But then translating that to community members, the graphics and illustrations are there to be able to kind of bridge the gap.
Any other comments, suggestions, feedback from the audience on other improvements, enhancements to the active transportation toolkit? Okay, well, maybe we'll just wrap up then, seeing no other comments or questions. Really appreciate all of you tuning in to this session. Julia, did you have any final comments or remarks you wanted to make, or should I just adjourn the meeting?
Just a huge thank you to our panelists and the team. This project has been a while in the making, and we're really excited to launch it and make it really accessible and useful for folks. So huge thanks to all of you. Thank you to everyone who joined us this morning to learn about this toolkit.
Okay. Thanks, everyone. Bye-bye.
Thank you.